From NBC News, this is Today.
Ladies, thank you very much. As you know, as part of No Shave November, we are trying to raise awareness for some very, very important men's health issues. We've made our way to Lenox Hill Hospital's Prostate Cancer Center, and we're joined here by Dr. Nancy Snyderman. Nancy,
and I'm not a proctologist, as you know, nor a prostate expert, but because you're here, we want to talk about prostate health because prostate cancer is the second leading cause of death in men. And while we're going to talk about screening today, we want to talk about the parameters around smart screening. So as we do that, a reminder that because you're in a doctor's office, and this is a doctor speaking, we're going to talk about real medical images. Take a look. Power, strength, and in control. Just some of the images men try to convey. But all too often, when it comes to medical tests, their attention comes up short. It's estimated that this year, more than 238,000 new cases of prostate cancer will be diagnosed in the U.S., and more than 29,000 men will die from the disease. 1 in 6 men will be diagnosed in his lifetime. The average age of a diagnosis is 67. The prostate is a small walnut-shaped gland located in front of the rectum and below the bladder. It produces fluid that nourishes and transports sperm.
The issue with prostate is that it surrounds itself with all these sensitive nerves that are responsible for sexual functions. And that's why every man is freaked out about it.
The most common testing method for detecting prostate cancer is a blood test called the PSA. It checks for elevated levels of protein produced by the prostate. Also included, a rectal exam, where a doctor inserts a finger to feel the prostate. With Matt's PSA test already completed, Al headed to the NBC medical clinic to have his blood drawn by specialist Howard Greenberg.
How you doing, all right?
Doing fine.
After the test, the blood is sent to a lab where it can take several days for results.
I feel a certain sense of relief, if you will. It really is all about knowing.
It's a reminder again that an elevated PSA does not necessarily mean you have cancer. It does mean you should have an intelligent conversation with your doctor. And if cancer is detected, know that there are a lot of options available to men now. You should never feel rushed into doing something before you're really ready. And I know you're here this morning to get your prostate checked.
That's right. We're going to do it. By the way,
with your doctor.
Yeah, Dr. David Samadi. He's the chairman of urology and the chief of robotic surgery here at Lenox Hill Hospital. Full disclosure, you're my urologist. We've been going through these exams for several years because I have a family history.
Absolutely. First of all, let me give you a huge compliment for doing this. We're going to save a lot of men with prostate cancer and prostate health. I've been seeing Matt for about 5 years now.
Right.
Your PSA has been quite steady, which I'm very happy about. Just for the numbers, it started with 0.7 and now it's around 0.9. So it hasn't moved, and that's what we pay attention to, the velocity, and that's very important.
That's one side of the screening. We're going to go in now and do the other side of the exam. So as we do this,
we should say this is the digital rectal exam.
Exactly
so
right.
you
We're
guys
not
go
going to show it. The camera will stay out here, but we'll go in this room. All right.
And Nancy, as Matt goes in, it's also very important in the African American male community. This is a big deal.
Well, it is, because I don't think most African American men know that you're 60% more likely to get prostate cancer, and many times the cancer itself is more aggressive. You know, something happened in American medicine in the 70s when we became very race conscious and we took race out of medicine. That was a bad idea because race makes a difference with some cancers. So the fact that you're being screened today and taking care of this is important.
So you can see how fast that was. Are there any downsides to this, or can there be any complications?
There are no complications to screening. What we want people know is get your PSA baseline at the age of 40. Certainly talk to your doctor, because that individualized medicine is extremely the key. And we want to make sure what the trend of the PSA is.
So it's the trajectory of the change of the PSA, because we do want people to know that if you just make an action based on one test, you can have problems with biopsies, et cetera. So we want people to make intelligent decisions.
Is there a range you should be in?
There's no such thing. We look at the numbers and we'll see exactly how it goes.
And you're fast too.
Certainly, family history plays a big role, and also the race. We know that it's more common among African Americans.
The most important question, did it hurt?
It doesn't hurt at all, and it took 34 seconds from what I'm being told from the control room. Is it the best 34 seconds of your life? Probably not, but if in 34 seconds a guy like this can detect something that might save your life, what are we talking about?
Well, what he doesn't know is that I had to lose 5 pounds in order to make my finger a little smaller.
He's here till Thursday. Try the veal. No, it's my turn, right?
But the bottom line is, you know, your prostate is...
You go, and we'll wait for you.
It's perfect. It's fine,
Your prostate is healthy. It's a normal size. It's smooth. I didn't feel any nodules, which is a big concern.
Right.
So you're perfect. Now we know your PSA.
If he had been sensitive, would you have thought, oh, maybe there's an underlying infection?
So we would be treating him if his PSA was high or if there's anything abnormal on the exam. I may give him some antibiotics, repeat the PSA, and then go into biopsy.
But you're basically feeling a sponginess to the prostate and looking for any nodules that might be there that maybe you think they have a mass.
That's a great point. Prostate is usually soft like this. If we feel some nodule and hardness, Nancy, you're absolutely right. Yeah. We need to look into it. So you get a lot of information from this exam.
I think your next patient's waiting for you.
All right. Al, good luck. We'll see you in a couple of minutes.
For the second opinion, we're going to use 2 fingers.
Yeah, okay. See if you can beat 34 seconds, Doc. All right, Nancy, thank you so much for being a part of this.
We'll have Al's report
Results
in the next half hour.
We certainly will. We're going to have much more ahead. Again, it's all part of No Shave November, raising awareness for men's health. Let's go back to Savannah, a few blocks away. Savannah?
All right, we're so proud of you guys. Could have done without the finger humor, gonna say.
But you know, you gotta laugh to keep you from crying.
This 34 seconds is all it takes, and it's so important.
Save lives.
It's absolutely. Coming up, we might be going to Al. Am I hearing right? We're going back to Al?
Oh, is he done that quickly?
No. Gosh, this is so exciting. This is the most exciting prostate exam I've ever not witnessed. It really is.
It's very intimate for sure.
Let me tell you what's coming up when we see
PSA is a little higher than that. It's about...
Oh, wait, hold on. Okay, now, how'd that go?
So the exam was actually, it's a little enlarged, but it's not terrible. I don't feel any nodules or any abnormality, which is good. So I'm going to monitor him once every 6 months, every year, to see exactly whether the size of the prostate is going to change. Are we going to find any kind of firmness in the future and look at the PSA?
So you correlate his blood test, the change in it, and what you feel, and put that all together as part of his prostate health.
What's important also is to know whether there's any family history, anybody else that has prostate cancer. So you put all of this information, and then you decide whether we're going to go for biopsy or not. And you're 100% right. Not every elevated PSA means
And here comes
biopsy.
Al. And so I'm going to ask you the same thing, because I think this is what scares men. Did this rectal exam hurt?
No, it's not comfortable, but you know, it's certainly obviously doable, and it's 34 seconds.
There you go.
And I think a lot of guys are also concerned about the embarrassment factor of it. So if my advice would be, find a doctor you're very comfortable with, that embarrassment factor is not going to be an issue.
And remember, physicians aren't embarrassed about doing this, so we don't want patients to be embarrassed. This is a partnership.
I think this is a very, very important point. The bottom line is you can save lives by doing these kind of things. That information and the data is extremely important, and don't be scared.
Dr. David Samadi, thank you very much, sir. We really appreciate it. Nancy, thanks for your input and your information. We're going to have much more ahead. Let's go across the street once again to Savannah.
All right, let's give you guys a hand this time.
Guys.
All right, thank you very much. I hope a lot of people are paying attention.